You may have heard that the best way to urinate less frequently is by doing pelvic floor exercises or taking medication. But you can actually train your bladder in just a few seconds without having to do any of that. Now, just a disclaimer here, I'm an occupational therapist. I'm not a doctor. I don't give medical advice. If you want medical advice about your pelvic health, you should always see your doctor about this. Okay, so here's the problem. A lot of us are just losing sleep because we're getting up 1, 2, 3 times during the night because we have to pee. We can't fall back asleep. And this could be because of older age, just a weaker bladder. Maybe you're pregnant or you just had childbirth. Maybe you had a surgery or a UTI. There's a ton of different reasons. Or maybe you don't have any issues at all. Maybe you just have to train your bladder. But the fact is, a lot of us are just not getting sleep, or we have these issues of frequent urination. Now, a lot of this can be because we just have a weak pelvic floor, but a lot of it is just because we're emptying our bladder way sooner than we should be. Now, a lot of you may be thinking that you pee all the time because you're getting older, but I have a 6-year-old who would pee every half hour if we would let him. So age may cause a weak pelvic floor, but it's not the primary reason that you're urinating more often, because my 6-year-old doesn't have a bladder problem. A lot of it just has to do with just training our mind. Now, I'm going to talk about the solution to bladder training in a second, but the first thing we're going to talk about is just the basics. So many of us are obsessed with our caffeine fix, drinking coffee or soda. If you drink caffeine, you're going to pee more frequently, and I know a lot of us know that, but it's just a fact. So reduce your caffeine intake and you'll reduce your urination frequency. I've actually stopped drinking caffeine about 10 years ago, and I feel great. I think it's a great solution, but also I'm not judging any of you. You have to do what you have to do, but caffeine is definitely something that will make you urinate just a whole lot more frequently. The second thing to do is just to drink less before you go to sleep. You probably already know this, but I'm just saying it for anyone who's out there who's just drinking a gallon of milk or water before they go to sleep. Just try to avoid drinking a ton before you go to sleep. Okay, now we're going to talk about the solution. So let's talk about bladder training. And all of this is from Harvard Medical. So if you weren't listening earlier, this is where the part where you kind of want to pay some attention to this, okay? So having a normal bladder means urinating every 2 to 4 hours. If you pee more often, then you need to train your bladder. And this is all about resisting the urge or bladder control. And what you want to do is you just want to stop what you're doing. You distract your mind. You apply pressure to your pelvic floor by doing 3 to 4 pelvic contractions or Kegels. And then also what you can do is just take some deep breaths through just regular breaths or just diaphragmatic breathing. But let's go ahead and talk about this in a minute. So the first thing is just to kind of stop whatever you're doing. So let's say you have the urge to pee and you're at work. The first thing you want to do is just stop whatever you're doing and you want to take your mind elsewhere, okay? So you want to just get your mind out of whatever you're doing, go to a different place, try not thinking about peeing unless it's been like 2 hours. Like it's been a period of 2 hours or more, like go release yourself, use the restroom. But what you want to do is just get your mind off of it. If it's only been 30 minutes, if it's been an hour and you have to pee already, just go to a different place. Try not to think about water. Don't take your mind to the ocean. Get to a place where you can kind of control your thoughts a little bit. Just get your mind anywhere than focusing on having to urinate. Okay, the second thing that you're going to want to do is you want to strengthen your pelvic floor a little bit. You want to do a little bit of contractions. And the easiest way to think about this for men, the saying I heard recently is nuts to your gut for men. You're just contracting that muscle. And for women, it's like you're picking up a blueberry. So what you want to do is you just contract that pelvic floor a little bit. So you're trying to get more control of your pelvic floor. And another way of thinking about this is right where your pelvis is or your pelvic floor, you want to focus on the abdomen muscles that you have there for strengthening. Just focus on those muscles. Do those contractions. What you can do is you do between 3 to 5 contractions, and that can actually take the need to urinate like right away pretty quickly. So distract your mind a little bit and then just start doing some of those Kegels, and that can just put you in a great position to be more in control of urinating. Now, the last thing you want to do is just some nice deep breathing just to kind of get your mind elsewhere. But you can also focus on diaphragmatic breathing. And this is just another good way to strengthen your pelvic floor. Now, diaphragmatic breathing it's not breathing, with our chest expanding. That's just regular breathing. So what you can do, you can just do a nice deep breath. Or you can do diaphragmatic breathing. And the easiest way to do diaphragmatic breathing is you want to kind of hold yourself, like hold your chest nice and tight, and you want to not let your chest expand. So hold yourself and you breathe in and out, and you're going to start noticing that you're using your abdomen muscles a lot more when you do that. And you want to just kind of focus on your lower abdomen muscles while you're doing that, and that's going to help you kind of start moving your pelvic floor while you breathe. And it's just an easy way to kind of relax and also to kind of take your mind off of everything. So that's kind of the simple process on training your pelvic floor. The whole idea here is to not let your bladder be in charge. You want to let your mind be in charge. You want to be able to take control of your bladder. And the easiest way to do that is to stop whatever you're doing and just take your mind off of everything. Start contracting your pelvic floor a little bit and work on that breathing or diaphragmatic breathing. They talk about like don't hold your bladder because it can cause problems, which is true when you have a full bladder. But if you don't have a full bladder, a lot of times you shouldn't be emptying it regularly. You should be resisting the urge to urinate. So that's something that we can share with our patients. If you work in the hospital, if you work with patients that have an overactive bladder and they're just peeing all the time, a lot of times we'll use like a PureWick, which a PureWick just kind of collects the urine for women all the time, and it can cause a lot of issues, and I hate using it in the hospital because these patients will never get out of bed. They just stay in the bed all the time. I think this can be really useful in the hospital because training patients on learning how to train their bladder can be so much more useful than having to rely on something like a PureWick where they can just pee whenever they want all day long and their bladder is never full, and so they just start peeing every 20 or 30 or 40 minutes, and they never like strengthen their bladder. They're not doing anything good for their bladder, and they end up just having all of these urinary incontinence issues because they're so reliant on these external devices. And if we can start training people just how to manage their bladder better, it's going to cause less problems with urinary incontinence. It's going to cause less problems with people falling, because a lot of times people fall because they're getting up to use the bathroom in the middle of the night. And so I think this is just a good conversation to start having with our patients in the hospital. All right, guys, I hope you found this information helpful. If you believe in improving your health through meaningful activities, definitely subscribe below, and I will see you in the next one. I hope you have a great day. Thanks.